What if the most effective support for blood sugar, cholesterol, and weight control wasn't found in a prescription bottle, but in a single leaf used for centuries in traditional medicine? While most people over 30 are told to rely on strict diets and lifelong medications, research is now revealing that this miracle leaf for diabetes may offer benefits science is only beginning to understand. Contrary to common belief, nature doesn't work slowly. Clinical studies show that this plant can help lower glucose levels, reduce LDL cholesterol, and assist in healthy weight management, often within weeks of consistent use. And unlike synthetic drugs, it does this with minimal side effects and real biochemical synergy. For those tired of chasing fragmented solutions, this natural herb for weight loss presents a powerful, unified approach. In this video, you'll discover what this plant is, how it works in the body, the ideal way to use it, and what science actually says about its safety and effectiveness. Whether you're managing blood sugar, watching your cholesterol, or simply looking for a sustainable path to better health, this medicinal plant that reduces cholesterol could be a game changer. Stay with us and explore how one leaf can transform the way you take care of your health naturally, effectively, and with results you can feel. Don't forget to subscribe to the channel to receive content that turns knowledge into action and helps you take control of your well-being. Among the most studied natural remedies for chronic conditions like diabetes and high cholesterol is a plant widely recognized in both traditional and modern medicine, Gymnema sylvestre, commonly known as insulin plant or miracle leaf. Native to the tropical forests of India and parts of Southeast Asia, it has also adapted well to regions in South America and Africa. This plant's reputation as a miracle leaf for diabetes stems from centuries of use in Ayurvedic treatments, particularly among aging populations seeking natural metabolic support. Depending on the region, the plant is either cultivated in community gardens or grown commercially for therapeutic use. Its adaptability allows it to thrive in warm climates with moderate rainfall, and today it can be found in herbal markets around the world. In Brazil, for instance, it's often sold under the name Folha de Insulina, making it accessible to people looking for a natural herb for weight loss or metabolic regulation. There are several ways this plant can be prepared and consumed. Fresh leaves are chewed directly or steeped in hot water to make herbal tea, a traditional method still widely used. The dried leaves can also be ground into powder for capsules or added to smoothies. Standardized extracts in tablet or capsule form offer convenience, especially for those with a structured supplement routine. Each format serves a different lifestyle and health objective, making the plant versatile and approachable. Choosing the right form often depends on individual goals and preferences. While tea may appeal to those seeking a calming daily ritual, capsules are often preferred by those looking for consistency in dosage. Regardless of the format, the medicinal plant that reduces cholesterol has gained attention for its multifunctional properties, paving the way for deeper exploration into how its biochemistry interacts with the body. The therapeutic potential of Gymnema sylvestre, the so-called miracle leaf for diabetes, lies in its rich biochemical profile. Among its most significant compounds are gymnemic acids, a group of saponins that interact directly with taste receptors and glucose metabolism. These molecules are credited with blocking the ability to taste sweetness and reducing sugar absorption in the intestine, a key mechanism in blood sugar control. Their presence is what gives this plant its unique antidiabetic properties. Another essential component is the presence of polyphenols, which act as antioxidants. These compounds help neutralize free radicals, reducing oxidative stress, a common issue among individuals with metabolic syndrome. In this context, the natural herb for weight loss plays a protective role, preserving cellular integrity while supporting fat metabolism. Alkaloids and flavonoids further contribute to anti-inflammatory and lipid-lowering effects, enhancing the plant's therapeutic value. Compared to other phytotherapeutic options, Gymnema sylvestre stands out for its multifaceted action. While green tea and cinnamon are known for their antioxidant properties, and berberine for its insulin-mimicking effect, gymnemic acids uniquely inhibit sugar receptors and absorption. This combination of mechanisms offers a broader metabolic benefit, making the plant suitable for those managing more than one condition, such as high glucose and elevated cholesterol. This complex interaction of saponins, polyphenols, and alkaloids provides a biochemical foundation that supports the plant's growing use in integrative medicine. Rather than targeting a single symptom, these compounds work in synergy, balancing metabolic functions and contributing to long-term wellness, especially in populations over 30 seeking more natural and sustainable solutions. One of the most well-documented benefits of Gymnema sylvestre, the miracle leaf for diabetes, is its direct action on insulin dynamics. The plant's active compounds, particularly gymnemic acids, stimulate the regeneration of pancreatic beta cells, which are responsible for insulin production. In individuals with type 2 diabetes, this can lead to improved endogenous insulin response, reducing reliance on external medications over time. This regenerative effect is rare among herbal treatments and places this plant in a unique therapeutic category. In addition to boosting insulin production, this medicinal plant that reduces cholesterol enhances insulin sensitivity in peripheral tissues, particularly muscle and fat cells. By improving cellular responsiveness to insulin, the body can transport glucose from the bloodstream into cells more efficiently. This dual mechanism, increased production and improved sensitivity, contributes to more stable blood glucose levels throughout the day. Another notable effect is the regulation of postprandial and fasting glucose. Several studies have shown that regular intake of Gymnema extract can reduce post-meal glucose spikes by limiting sugar absorption in the intestines. Fasting glucose levels have also been shown to decrease, often within 4 to 8 weeks of consistent use. In a clinical trial involving type 2 diabetic patients, a 400 mg daily dose led to an average 20 to 25% reduction in fasting blood sugar after 3 months. These clinical outcomes reinforce the plant's role in modern diabetes management. Unlike medications that often treat symptoms in isolation, Gymnema sylvestre offers a broader metabolic modulation. For adults over 30 seeking sustainable glycemic control, it presents an option that aligns with both natural health philosophies and evidence-based science, a rare and valuable combination. In addition to its glycemic benefits, Gymnema sylvestre has demonstrated promising results in lipid profile modulation, making it a valuable medicinal plant that reduces cholesterol. Clinical studies have observed reductions in LDL cholesterol, the so-called bad cholesterol, and triglycerides after sustained use of Gymnema extracts. These effects are particularly relevant for adults over 30, a demographic commonly affected by dyslipidemia and metabolic syndrome. The plant's influence extends to increasing HDL cholesterol, known for its protective role in cardiovascular health. By improving the balance between LDL and HDL, Gymnema contributes to overall vascular protection, potentially reducing the risk of heart disease. Its biochemical compounds, especially saponins and polyphenols, appear to enhance lipid metabolism and support healthier arterial function, aligning with long-term preventive strategies. Mechanistically, Gymnema works through several pathways. It inhibits cholesterol absorption in the gut, promoting greater excretion of bile acids, a process that lowers circulating cholesterol levels. Additionally, the plant may upregulate hepatic enzymes responsible for lipid breakdown and clearance, further supporting its action on triglycerides. This multifaceted approach distinguishes it from synthetic statins, which often act via a single inhibitory pathway. These lipid-lowering effects, though moderate compared to pharmaceuticals, are significant when combined with diet and physical activity. For individuals seeking a natural adjunct to manage cholesterol, Gymnema sylvestre offers a safe and effective option. Its integration into a broader health protocol reflects a growing interest in phytotherapy as part of comprehensive cardiovascular care, especially among older adults aiming to reduce pharmaceutical dependency. Among the plant's many attributes, Gymnema sylvestre has gained attention as a natural herb for weight loss, especially for individuals struggling with metabolic resistance. One of its most relevant effects is the inhibition of lipogenesis, the process through which excess carbohydrates are converted into fat. By interfering with this metabolic pathway, Gymnema helps limit fat accumulation, particularly in the abdominal region, which is closely linked to cardiovascular and insulin-related disorders. Another mechanism involves the stimulation of thermogenesis, the process by which the body generates heat and burns calories. Compounds in gymnema, including certain saponins, may enhance energy expenditure even at rest. Combined with improved insulin sensitivity, this effect contributes to a gradual reduction in fat mass without triggering drastic changes in appetite or energy levels. It becomes especially beneficial for adults over 30 who face natural declines in metabolic rate. Equally important is the plant's impact on satiety. Gymnemic acids have been shown to reduce sugar cravings by blocking sweet taste receptors on the tongue. This sensory effect, although temporary, can significantly influence eating behavior and support adherence to a lower-calorie diet. In turn, users report feeling more in control of food choices, particularly in moments of emotional or impulsive eating. Clinical studies have echoed these effects with measurable outcomes. One trial found that subjects using gymnema extract over a 12-week period experienced notable reductions in BMI and visceral fat compared to a control group. These results, although moderate, highlight the plant's role as a complementary agent, not a substitute, in structured weight management programs, reinforcing its value in integrative health strategies. To fully benefit from Gymnema sylvestre, the so-called miracle leaf for diabetes, proper usage and dosage are essential. The most traditional form is herbal tea, prepared by infusing 1 to 2 grams of dried leaf in hot water, taken once or twice daily. This method is preferred by those seeking a calming ritual, while gradually integrating the plant's compounds into their system. It also allows better control over dosage, and is suitable for individuals sensitive to concentrated extracts. In capsule or tablet form, standardized gymnema extracts typically contain 25% gymnemic acids. The recommended dosage in clinical studies ranges from 200 to 400 milligrams per day, often divided into 2 doses before meals. This format ensures consistent intake and is ideal for individuals who prefer a more structured supplement regimen. 4 powdered forms, half a teaspoon, approximately 1.5 grams, mixed into smoothers or water is commonly used, maintaining similar metabolic benefits. Timing also plays a role in maximizing efficacy. Taking the supplement 20 to 30 minutes before meals appears to enhance its effect on glucose absorption and appetite regulation. For those using it to manage postprandial blood sugar spikes or cravings, pre-meal consumption is especially recommended. Consistency is key. Skipping doses may reduce its cumulative metabolic impact, particularly in individuals seeking blood sugar or weight control. As for duration, most clinical protocols observe meaningful results between 60 to 90 days of continuous use. While some users report initial changes in as little as 4 weeks, long-term improvements in glycemia, lipid profile, and weight are typically noted after 3 months. Rotational use, such as 3 months on, 1 month off, is sometimes practiced to maintain sensitivity and reduce the risk of adaptation, especially in ongoing wellness plans. Although Gymnema sylvestre is generally considered safe, even natural remedies like this miracle leaf for diabetes require careful use. Among the most commonly reported side effects are mild gastrointestinal symptoms, such as nausea, bloating, or constipation, especially during the first weeks of use. These effects are usually temporary and tend to subside as the body adapts to the herb's active compounds. Starting with lower doses and gradually increasing can help minimize discomfort. A key consideration involves drug interactions, particularly for those already managing chronic conditions with medication. Gymnema sylvestre may enhance the effect of antidiabetic drugs like metformin or insulin, potentially leading to hypoglycemia. Likewise, its impact on lipid metabolism could interact with statins or other cholesterol-lowering agents. For this reason, individuals using prescription medications should consult a healthcare provider before adding this natural herb for weight loss to their routine. Special attention is required for certain populations. The use of gymnema is not recommended during pregnancy or breastfeeding, as there is insufficient evidence regarding its safety for the fetus or infant. Additionally, individuals with autoimmune disorders or those undergoing treatment with immunosuppressants should approach this herb with caution due to its possible immune-modulating properties. Lastly, dosage control is essential. Excessive intake beyond the recommended therapeutic range may cause an undesired drop in blood sugar levels or interfere with normal digestive function. Sourcing also matters. Poorly processed or contaminated supplements can introduce other risks. For adults over 30 aiming to use this medicinal plant that reduces cholesterol responsibly, informed use is the key to safe and effective outcomes. Beyond its medicinal uses, Gymnema sylvestre can be integrated into daily meals, offering both therapeutic and nutritional value. In its powdered form, it can be added to green juices, smoothies, or detox drinks, enhancing their metabolic impact. Its mildly bitter taste blends well with citrus fruits or mint, helping to mask the herbal flavor. This approach is especially practical for those using the natural herb for weight loss as part of a balanced diet. In savory preparations, the dried leaf powder can be used as a seasoning in soups and broths, particularly those made with legumes or vegetables. Its heat-stable compounds retain much of their activity even after brief cooking, making it a functional addition to warm dishes. In some regions, fresh leaves are sautéed lightly with garlic and olive oil, then served as a side dish, a practice that supports both tradition and nutrition. To preserve its active compounds, especially gymnemic acids, it's important to avoid boiling the leaf for extended periods. For teas, a gentle infusion of 5 to 7 minutes is sufficient. When using the powder in recipes, add it toward the end of cooking to retain potency. These small adjustments help maximize the benefits of this medicinal plant that reduces cholesterol without compromising flavor or texture. Functional recipes using Gymnema include herbal vinaigrettes, low-glycemic muffins, and detox soups. Pairing it with ingredients like ginger, turmeric, or cinnamon can amplify its metabolic effects while offering culinary harmony. These applications make it easier for adults over 30 to adopt the plant into their routine naturally, transforming therapy into a daily habit and health into a lifestyle. Become a member of our channel to gain access to exclusive content, practical guides, and early insights into natural therapies that are shaping the future of preventive health. If you're serious about improving your health with evidence-based alternatives, this is where your journey deepens. This miracle leaf for diabetes challenges what many have accepted as permanent dependence on medication, limited options, and gradual decline. By understanding how nature works and applying it wisely, you open doors to long-term metabolic balance, better cardiovascular health, and sustainable weight management. It's not about replacing your current treatments overnight, but about expanding your possibilities with real science and tradition working together. Have you ever tried incorporating a medicinal plant into your routine? What results did you experience? Share your insights in the comments. Your story could guide others. And if this content was helpful, subscribe to the channel and activate notifications so you never miss an opportunity to improve your health with clarity and purpose. Your well-being deserves more than quick fixes. It deserves knowledge, consistency, and the courage to explore new solutions.